Subcutaneous injections. Subcutaneous injection is administered into the subcutaneous layer of the skin. First, we have to disinfect the area with alcohol swab. Pinch the skin and now administer the medication at the 90 degree. After administering the medication, withdraw the injection and press it with a cotton. Intramuscular injection, we need to disinfect the area with alcohol swab and then insert the needle at 90 degree of angle, aspirate the syringe and check for the backflow of blood. If no blood, then inject the medication and remove the needle. Press the side with the help of cotton. Intradermal injection is administered into the dermis layer, for which we have to disinfect the area and then let it dry. Insert the needle at 10 degree of angle into the dermis layer and inject the medication. After this, a bleb will be formed which indicates that medication has been administered into the right layer of the dermis. To clean the injection task trainer, we have to remove the skin from the upper layer and then the water or the fluid which have been soaked, that can be cleaned with the help of a cotton towel or a cotton cloth. Once it is cleaned, the skin can be fixed again, after which it will be ready to use once again.